Welcome to Healthcast, where leaders and experts from Stony Brook Medicine come together to discuss a range of topics, from leadership and strategic planning to patient care and the inner workings of a successful healthcare system.
Hello, and welcome to Healthcast. I'm your host today, Dr. Jonathan Buscaglia, and I'm joined by Dr. Vito Alamia and Dr. Julie Welischar. We're going to be talking today about some of the incredible mission trips that Stony Brook providers have participated in over the years, and more specifically, the most recent trip Vito and Julie went on in Ecuador. Before we get started, I'd like to ask you both to introduce yourselves to our listeners and our viewers. Vito?
Yeah, my name is Vito Alamia. I'm a practicing OBGYN. I've been practicing out on the East End for over 25 years. I was actually a Stony Brook resident and medical student. So I've been through the system for a long time. And I started doing mission trips about 23 years ago.
Wow, great. And Julie?
Julie Welischar. I, too, graduated from Stony Brook. I was a resident under Vito. Well, he was leaving and I was coming on.
Okay.
And I've been in practice here, private practice, and then joined Stony Brook Community Medical in 2018. Been here for about 22 years.
Now for a little background. A mission trip is an organized effort where healthcare professionals volunteer their time and skills to provide care to underserved populations. These trips often aim to address critical health needs, improve health outcomes, and save lives. So Vito, let's start with you. Tell us a little bit about some of the background on these mission trips that you've taken on over the years. You mentioned 24, is that what you said?
So I started in 2003, and I've been doing, except for COVID, I've done at least one a year since then.
Wow.
I got involved with a organization called Operation International. We're strictly a surgical mission. So it's non-denominational, and our focus is to provide free surgical care for people in the most need. And we literally travel the globe to provide the care. We take donations and we buy the equipment, and then we literally carry them with us wherever we go. So we'll take 40 bags of surgical supplies, set up shop in one of the countries, and then basically start an operating room from scratch. We bring all the people that are required and get it done.
So how do you choose which country you're going to go to? And also, how do you choose what surgical services that country is most in need of? I mean, both of you are OBGYN physicians, surgeons. So tell me a little bit more about that selection process.
So the team that I usually travel with is called Team New York. It's a group of 2 general surgeons, a plastic surgeon, gynecologist, and those are the services that we provide. And then what the organization does is it looks for sites where the need is good, but also, when I say good, I mean, really important because they have no care. But also there's facilities where we could operate out of. There's physicians there that we could train and also could pre-screen the patients before we get there, as well as, do aftercare after we leave. And then when we first get to the site, we'll see a couple of hundred patients and make an OR list and then, go from there.
So just a quick follow-up. Over the years, have you gotten to a place and then sort of said, in addition to general surgery, OBGYN, plastic surgery, there's other needs we want to expand or bring on? Or has it been that sort of core group of specialties that you described right from the beginning in most countries?
So as an organization, Operation International had Team New York only. And then over the years, we've added on other specialties. So we have a pediatric team, a neurosurgery team. We have a dentistry team, an ENT team, plastics team. And so what Team New York will do is go to a site, see what the need is, and then if it's a site that we could send teams back to, we'll send the team based on the needs that the local population has.
So they go ahead of time and make an assessment and then sort of take...
So we do like a pilot mission. And that's kind of what we did in Ecuador.
Okay.
So we do a pilot mission. We assess the hospital, we assess the doctors, and then, leave the supplies that we bring there. And then hopefully if it's a a good site, we can have other teams go back.
Okay, great. So, Julie, this was your first mission, right?
Correct.
And Ecuador was your first.
My very first introduction to a mission, which,
So tell us about it.
well, it was incredible. I loved going. I loved, working on these cases with Vito. It was a different experience than I had initially had in my mind, because when we first landed, there's this bunch of people greeting us, and I'm like, where are these people from? And all of a sudden the military's behind us and they're flanking us, and I'm like, all right. And I sort of like, what should we do here?
Yeah.
So I didn't I was kind of taken back by that level of security that was needed, but I am so blessed to have been part of this mission. It has changed my life.
So the military presence was for security purposes.
Yeah.
Can you tell me a little bit about that in Ecuador? I don't, I know that there were some concerns about the safety of the volunteer physicians. So, yeah, talk a little bit about
I never felt in any danger. I thought we were well secured. But in January, right before we left, they had increased the threat level at Ecuador to level 4 and do not travel. And I had seen it, and I sort of like paused, and I was like, I don't know what I'm doing. And then I spoke to my friend who's an orthopedic, and he does Blanca's house there. And he's taken his wife, he's taken his daughter. He said, Julie, don't worry, it's totally fine. I'm like, okay, I'll go.
And Blanca's house, just for reference, is another missionary
It's
group.
another group.
Yeah.
I believe they do mostly orthopedics.
Okay.
And I said, okay, great. But then when I got my feet on the ground and behind me was the, military, I was like, oh boy, this is going to get interesting.
Yeah.
A little scary, but nonetheless, a great trip.
Yeah.
So this particular site, I decided to go to because the need was so great. And it turns out that there was a couple of other surgical missions that started to go there and then aborted at the last minute and didn't show up. Part of the reason was that in this particular part of Guayaquil, the Colombian and Mexican cartels basically control the area, and there's a high rate of crime, and there's also a high rate of kidnapping. And so, and a few years ago, they had kidnapped a family physician and his wife, and held them for ransom and things like that. And so, the level of security was basically to deal with that kind of.
Wow.
Yeah.
Wow. Fascinating. Well, let's change gears a little bit and talk about the team. So, tell me, Vito, about the team that was assembled for the trip to Ecuador. Maybe a little bit more. You talked about some of the specialties. What kind of cases and things like that were you guys doing there?
Yeah. So specifically, the team that went to Ecuador is a women's health team. I started the women's health team. This will be our second trip. First time we went to Ghana, and then this is our second trip to Ecuador. So it's women's based focus. So we had 4 gynecologists. We had a breast surgeon who does a lot of oncology. We took a general surgeon with us as well. And then we brought 3 nurse anesthetists so that we could have our own anesthesia in each of the rooms that we were working out of. And then we brought 3 recovery room nurses. We brought OR nurses to scrub and also to circulate. And then we brought a team of teachers, basically. We had a nurse educator and another teacher who brought all the equipment to do neonatal resuscitation, and we trained
a lot of educating.
Yeah. So it was a double mission.
Yeah,
surgery and education.
Yeah. So when you have this whole team with you, but I would imagine that you're incorporating some of the staff that works in the hospital already, Julie, into the team, like as you're taking care of a patient who has, GYN needs, for example?
So I didn't have anything really in regards to selecting who went on this mission trip, being the first, person. But I would imagine that they're selected by.
But I mean, did you work only with the team that you brought with you from the States, or did you work closely with some of the staff that are actually working at that hospital in Ecuador on a daily basis?
On this trip, we functioned with the team that we brought.
Just the team you
for the most part. There was some input from the local physicians there. They would see our patients post-operatively overnight. So we did, work with them, but in the ORs, we worked with our team that came with us.
Yeah. And also specifically, there were anesthesia people that were working at the hospital that, learned from our nurse and anesthetist. There were scrub nurses that were also in the room kind of rotating with us, seeing how we scrub, things like that.
Okay.
In this particular mission, there wasn't a lot of physician support. A lot of times there is. But we were there to teach. But in this particular mission, there was mostly just the care of the people that were there.
So you talked a little bit, Julie, about the security and the presence of the military, and that in and of itself, I'm sure, is a little bit of a challenge. But tell me about what you saw as challenging working day to day, in the hospital compared to perhaps what we have in the United States and the fortunate scenario we're in. What was it like? What were the challenges in the OR, for example, that sort of stuff?
So in general, I mean, if you don't bring it with you, you don't really have access to use it. So you sort of have to think on your feet. If you get sort of in a situation where you need to think quickly, you might not have powder that we have here in the OR to stop a bleeder or whatever. There was none of that. So you sort of had to figure it out and go back to the basics, go back to the fundamentals of surgery. And I really enjoyed that. I didn't find it a challenge at all. I loved it.
That's great.
I thought it was fantastic.
Yeah.
And the other thing I think is, kind of striking is when you go to these places, the disease process is so far along. So, the fibroids that you see in Ecuador are something that you see once in a blue moon here, but there, every single case, the uterus was huge or the prolapse was terrible. So you're working on the hardest cases with a very limited amount of supplies. And, if you don't have your suture, sorry, you have to use something else. But
so the access to care is more challenging, and so people are presenting with more advanced stage disease. Is that
exactly? Yeah. That's what I was saying. Exactly.
Yeah. Wow.
Especially there, I think it's largely that hospital deals with a lot of trauma, not a lot of women's health.
Yeah,
but low on the priority list.
Interesting.
You know what I mean?
Yeah, for sure. Tell me about, Julie, maybe what you saw as one of the greatest successes while you were there. Anything stuck with you?
I have a lot of stories, but
what was one of the best?
So when I had gotten there, as I mentioned earlier, I was a little bit not shaken up, but I was just a little bit on guard.
Yeah,
and I had we had done Monday's cases, and then there was this one woman, Daniela, and she was our Tuesday case, and she had a large fibroid, and she was probably my favorite case because she had a large fibroid and she had only 1 day to have her child care in place, and her husband had taken the day off and he wasn't going to get another day off. And so we were tired. We were going to reschedule the case till tomorrow. And I went over to her and I said, "What's the matter?" And she's like, "My children, they're 12, they're 8 and 4. They're going to be left home alone. You can't, and she started to cry. And so I looked at Vito and he decided to keep the team there. And up until that point, I hadn't had the aha moment of like why I was sort of like almost not regretting, but I didn't have that aha moment.
Why am I doing this?
This is so great. I need to do it again. And everybody had told me, once you do this, you're hooked.
It's like a bug.
And I was like, it's Monday night, and I'm like, I haven't been bit yet. So it's Tuesday, and we ended up doing her case, and we kept the team late, and it was a little bit challenging from that perspective because we had to all leave together. We went together, and we had to leave together. So
because of the security purposes, yeah.
So we did her case, and the next morning when we made rounds, she had written a letter to Vito and I. And I wish I had brought it, but I'll bring it another time. And it was just so endearing and so touching that, something so simple in my life had such an enormous magnitude in her life. And I was hooked. I'm hooked. I mean,
you have to tell them about the tattoo.
Oh, the tattoo, yes. So we walk in and we do rounds, and she has a picture of a uterus and her ovaries, and she pulls up her phone, and in Spanish she communicates with one of the physicians that we were working with, and she said she's gonna get a tattoo of Yuli and Vito next to a uterus on her arm. And she's like, can I get a tattoo? She asked permission. Yeah. She was really cute,
That's
but
sweet.
she was really, really grateful.
Yeah.
And that moment changed my whole perspective.
Yeah. Yeah, that's amazing.
She actually said she had tattoos of her 3 children, and she said this was as important as the 3 children to her.
Wow. Yeah, that's incredible just to think. I mean, what you removed a large fibroid?
So she had a large fibroid,
and what were her symptoms that she was battling?
She was bleeding for 4 months straight, and she was getting numerous blood transfusions. I mean, the uterus was up to here, if I recall. It was challenging, and it was stuck.
Yeah.
So not only did we do the case late, but it was a challenging case, and so she had been bleeding, and they can't work. They can't function. They don't have access. It's in our world, we would give them a birth control and TXA and problem solved. They don't have that there. This was enormously changing for her.
That's crazy. So you didn't just do cases there, Vito. You also, like you alluded to, you taught and you educated people. So tell us a little bit what that was like. What were the main things that you were teaching when you were there? And how did you incorporate the education part of this mission into the we're going to provide clinical service to people in need part of the mission?
So we had scheduled lectures for every day.
Okay.
We scheduled them over the noon hour. Sometimes we ended up doing it at the end of the day because of the surgery load. But each of the physicians was assigned a topic to discuss. And then in a classroom that was nearby the operating room, all the nurses, residents, medical students, whatever attendings were at the hospital would join. And in the lecture hall, we probably had between 60 and 80 people there.
Wow.
And we gave lectures on hypertensive crisis and pregnancy, in postpartum hemorrhage, breast cancer. The breast cancer surgeon gave that lecture, as well as a menopause lecture, because it's not something that they're very educated about. And then in addition, the nurse educated that we brought with us taught individual classes every day for neonatal resuscitation, both the practical part and the lecture part. And to me, that is probably one of the most important part of the trip, because we trained 256 people to do neonatal resuscitation.
Wow.
And they literally had no idea how to do it. And, you lose babies on a regular basis because they're not trained.
Yeah.
And so to me, this is like longstanding, improvement in the healthcare in the hospital.
Yeah. Well, you sort of segued into my next question for both of you, which is, as physicians, right, we help people every single day. But this is different. So what really inspires you to give up a week or two of your personal lives and to go there and do this?
Well, it forever changes you. And I've been meaning to do a mission for quite some time. I've been, asking Vito, and the dates never worked. And so you're right. It's a bit of a commitment on your end as a physician. The difference in the appreciation of care and just taking your gift and bringing it to people that are so deeply and profoundly grateful for you changing their life. There is nothing like it in the world. I'm forever a changed person.
That's incredible.
It's incredibly profound.
So I do it every year, and I've been doing it for a long time. And it's the thing that actually makes me grounded for the whole entire year. Mm-hmm. I get to practice medicine for the reason I went into medicine, which is to help people without any billing issues, without any, scheduling issues, without a million other responsibility. And I'm given the gift of being able to help people in the most need. Mm-hmm. And, I could honestly say that, in the 58 surgeries that we did, we really changed 58 people's lives and made that better.
Right.
Some of them life-saving, some of them, people able to get back to work. And they're always, always so grateful. And to me, it's like the most important thing about being a physician.
Yeah. So if somebody's thinking about it and they're on the fence, what would you say?
Buckle up.
Yeah.
It's definitely do it at least once, to see what it feels like. It's not easy. I mean, the conditions aren't easy. The operating room isn't easy. the language barrier, the carrying of the equipment. It's difficult,
It's a
but
sacrifice.
it's worth it.
Yeah.
It's really, really worth it.
How can somebody get involved? They know nothing about these missions. You mentioned, what was the name of the agency that you sort of collaborate with?
So the name of the organization is Operation International.
Operation International.
And now we have, like I mentioned, a bunch of teams. We actually have 19 different teams.
Okay.
And the best way to get involved is to, email us, and then we'll,
I assume they have a website that's easily searchable and get some more information that way.
Yep, that's exactly right.
Okay.
And, we do take people with specific skills, so I think, it's important to be able to offer us, something.
Right. Looking ahead, what's on the horizon for these mission trips? Any particular areas of the world or countries, and specific countries that you guys are looking at?
Yeah. So I don't think we're going back to Ecuador. It was a little too high risk for the women's health team. But I actually think we're probably going to go to Kenya. There's a site in Kenya that another team went to and had a very good response from the local people. There's a huge GYN need. And I think that's probably where the team is going to end up.
That sounds great.
Yeah.
Terrific. Well, I really enjoyed hearing from both of you guys and learning a little bit about these mission trips. It's really fascinating, and you should both be just congratulated for the work that you've done and the sacrifice and, what it takes to give a part of your life to these people. It's really amazing. And, I hope that I can do one as well one day.
You need
That'd be
to.
awesome.
I know. I hope I can. This is all the time that we have today. Thank you both for your expertise and your time. Thank you for the incredible work you do on these mission trips, and the people that you've served around the world. Vito, 24 times. Holy cow. And thank you to our listeners and our viewers. And be sure to subscribe and stay tuned for more episodes of Healthcast. Thank you.
Stony Brook Medicine is Long Island's premier academic medical center. We transform lives through scientific discovery, education, and care, and we bring together innovative research, advanced education, and extraordinary healthcare expertise to set the standard for how healthy communities thrive. For more information, visit stonybrookmedicine.edu or follow us on social media. Stony Brook Medicine on Instagram, Threads, Facebook, YouTube, and LinkedIn, and Stony Brook Med on X.